Many people associate dope smoking with the 1960s, but marijuana use is making a comeback again. It's an alarming trend that concerns even the experts who deal with the issue on a regular basis.
Marijuana use had been decreasing up until 2009 and is now increasing again. And as it is now, about 30% of high school seniors use marijuana in the last year.
Dr. Charles Resnikoff specializes in addictions at Hennepin County Medical Center in Minneapolis. He says marijuana is the second most abused drug behind alcohol.
Most of my time is with opiate addiction. However, most of those opiate addicts are also marijuana addicts or at least habitual marijuana users. So almost all of my patients have more than one addictions, and usually marijuana is one of them.
There are many myths out there regarding drug use, including the perception with people that marijuana is safe.
For young adults with developing brains, marijuana should be considered a mental poison, which will slow education and worsen some mental health issues.
Dr. Resnikoff also deals with the perception that people will be able to quit right away after only smoking marijuana one time.
If you use marijuana only once, the likelihood that you're still using it a year later is almost 60%.
Pot smoking can be especially dangerous when mixed with driving vehicles.
Any amount of marijuana used before driving would be unsafe.
Among other things, using marijuana can impair your reaction time, make you more clumsy, and make your space and time perceptions different. The doctor offered some ideas for what parents should be aware of if they suspect marijuana use with their children.
The child removes himself from the family, doesn't want to talk, doesn't want to be around the parents. Often that's the best red flag you have.
Dr. Resnikoff cautions parents to not overreact once they find out their child may be using marijuana or any other drugs. He says it's important for parents to not use accusations or judgments against their kids when they talk to them about suspected chemical use. He also encourages parents to get a professional evaluation done right away.
I would suggest that any young adult using marijuana be evaluated for mental health, because they could have untreated anxiety disorder, they could have untreated ADHD, they could have some form of pain disorder, they could be doing other drugs in addition that you don't know about.
It's important, according to the doctor, to get a marijuana problem under control as soon as possible. He says things will only get worse the longer using continues.
People who smoke marijuana in their young adulthoods tend to do less well in their adulthood. That's one. And then two, people who smoke marijuana in their young adulthood tend to have worse depression and anxiety as they age.
The Lakeville School District has a chemical awareness coordinator who specializes in teenage chemical dependency. The phone number for the awareness coordinator is 952-232-2091. That number once again is 232-2091. If you have any questions, I encourage you to contact the awareness coordinator.